I'm particularly excited for the next session, which is about women in global health, women leadership in global health. And as a woman in global health myself, I think this is a topic that is very, very close to my heart. And I think we've seen some incredible things happening with the incredible women in global health that we are lucky enough to have here in Ireland and in the countries that we work in. So I'm going to hand over to our wonderful chair, Audrey Carville. Thank you so much for being with us today, Audrey. Audrey, I know many of you will already know Audrey. She's an award-winning broadcaster and she currently presents Morning Ireland on RTE Radio 1. Prior to working in RTE, Audrey worked for over 2 decades with the BBC. So she presented news programs for the BBC World Service, BBC Radio 4, BBC Radio 5 Live, and many others. Audrey, we're absolutely delighted that you're joining us today, and over to you. Thank you.
Nadine, thank you so much indeed. It is my pleasure to be part of this conference. I'm delighted to be here today, moderating this really exciting panel that we have coming up for you this afternoon. And this is, as Nadine said, such an important conference overall, talking about these issues of health and healthcare and putting equality right at the heart of healthcare, both here in Ireland and indeed around the world. So we are going to continue that discussion now with 4 women who have shown remarkable leadership throughout their lives, throughout their careers in global health and related areas. And we're going to get a sense of their experience, their thoughts, their insights into what effective leadership is. Can it be taught? Can it be learned? Is it innate? Who inspires them? There's so much to talk about with our guests. So let me introduce our panel for you this afternoon. Dr. Mary Keogh is Advocacy Director with CBM Global Disability Inclusion. Now, they work alongside people with disabilities in some of the world's poorest places, and they work hard to fight poverty and exclusion. And Mary's leadership focuses on access to health and to other community-based services, taking in the vital issues like climate justice. So Mary, you're very welcome. We're also joined today by Eunice T. Phillip. Eunice is currently a global health PhD scholar and researcher at the School of Population at the Royal College of Surgeons in Ireland. And her vision, she says, is to increase that participation, to bring the voices on the margins, to bring those voices most left behind to the forefront of global health solutions. We're also joined today by Ailbhe Smyth. Now, Ailbhe is a long-time feminist and LGBTQI+ activist. She is the former founding head of Women's Studies at Trinity College Dublin. She played a key role in the marriage equality referendum. She played a key role again in the Repeal the 8th campaign of 2018. She is currently chair of Women's Aid. She's on the board of IGHN, and she's patron of the Women's Collective Ireland. And in 2019, Time magazine included her in the world's 100 most influential people. And our final guest this afternoon is Dr. Frederique Vallieres, Director of the Centre for Global Health at Trinity College Dublin. Her current research focuses on the application of psychology to global health, with a particular focus on global mental health. So a terrific panel to talk with us and to us for the next hour or so, bringing us up to 2 o'clock. So let's kick it off. And Ailbhe, could you maybe start and tell me what you think, and tell our audience what you think that word leadership means?
Well, it always makes me a bit nervous. And first of all, hello, Audrey. Hello to everybody on the panel, and how wonderful to be here at this conference. I feel, you know, so many of you work in the field of global health, in particular reference to women and to equality. And actually, I don't. But I hope I'm learning so much from all of this. Leadership kind of makes me nervous because I always think there must be some definition or some kind of explanation of it that makes everything clear, but I don't think that there is really. And I can really only speak for myself and say that I didn't grow up thinking I want to be a leader, and I don't know all that many women, at least, who did. And I still don't think of myself in that way, because as a campaigner and an activist, you know, the collective work, the working in a group, the working cooperatively is so absolutely key. But what I do know is that from when I was quite a young child, I suppose, really, I really didn't like things that were unfair, and I would stamp my foot and make a noise and give out. And I think that sense of anything that is unfair, that discriminates against people, that makes us feel less respected, less honoured, that means that we are deprived, that means that we have less, that means that we don't have access to resources. That has always made me personally very angry, and also often very, very upset and very, very sad. So because I lived in Ireland, and I've always lived in Ireland, and that's where I grew up, I thought I've always taken on things directly here at home, if I can put it that way. I'm not sure that I can give a definition of leadership, and I'm not really going to try. But I think for me, it has always been about the issue, the cause, the passion. What is it that I feel is really passionately wrong? And I'm just looking around at the faces of those on the panel, and I think you're exactly the same. It's the cause, it's the issue, it's something that drives you to say this has got to be put right. And I know some people who can help on this, and I know some actions we can take, or I know where to get help. And that also speaks to privilege, which I'm sure is something that we will come back to on the panel now.
Ailbhe, thank you so much. Mary, will you jump in now and give us your thoughts on what leadership means to you, and what you think of it when you hear that word?
Well, it's very similar to Ailbhe, and I'm so glad Ailbhe went first, because I saw my name on the panel. I was thinking, I'm hoping not the first speaker to set the tone for this. And I think Ailbhe's point around, you know, the naming, or the putting that authority label on yourself as a leader is not something I think any of us aspire to, that work within a community setting or work with bridge building for movements, because if you start to do that, you start to disenfranchise people from the very beginning. So, I mean, I was reflecting on this question as I was coming into the office on the Lewis this morning, in my own kind of role in advocacy leadership. And I know kind of the change that even I've gone through over the years, in terms of when I came out as quite a young activist around, you know, why you should be inclusive of disabled people. By the way, I'm a wheelchair user, so that's not visible on the video. And I was the one that always thought I knew the answers. So, because I come from this perspective of, you know, being lucky enough to be mainstreamed in education, coming through a university education. I was a UCD graduate as well, Ailbhe, many years ago too. And was coming out into working in the community, and working in at that stage a national level in terms of disability advocacy, and now my role is more global. And the one thing I've learned is that a leader does not know the answers. So looking to present yourself in that way, to say, well, I know all of the answers, is not the case. Leadership is about providing, I think we talk a lot about this scaffolding, putting a scaffolding in place that can enable others, the communities that we work with across different cultures. At CVM Global, where I work, is an international organisation. So a lot of our advocacy work is very focused with communities and countries who have no voice. So really trying to look at how to build that leadership, but not in that kind of capacity deficit mode, which we find ourselves in lots of times when we're talking about how do we build leadership, about how do I impart my skills, but more about how to look at that kind of community-owned leadership and how to bring that to the fore. So I think that's been, I suppose, my reflection, coming from kind of a young upstart activist thinking I knew all of the answers, to at least 30 years later going, I know none of the answers, but I understand that actually bringing people together in a space that is safe, that everybody can collectively input into, is actually how we really create leadership. And it's really not about an individual in any sense. Yeah.
Thank you so much, Mary. Eunice, what is your, not a definition as such, but when you hear that word leadership and you consider that word leadership, what does it mean to you?
It's just like Mary and Ailbhe said, it's about, for me, it's the co-creation of that solution. Like that is what that leadership is. I've always known that it's very lonely to be a leader, because if you put yourself at the top, then you're just lonely and you're just there. But when you actually bring everybody together to actually say, this is the issue we have, what do you think? And like Mary was saying, that community knowledge and bringing, everything together, and you there, if you want to be the chair or champion it, that's fine. But the term leadership itself is actually means followership, because for you to be a leader, you must be a follower. So I think for me, that's the way when I wake up in the morning and I think of what I'm going to do in global health today, that's what I think of. Like, how can I be a follower in the midst of all the other voices that are there? Thank you.
Thank you so much, Eunice. Frederique, what's your view on this question?
Can you hear me okay before I answer?
Yeah,
okay, perfect. I'm talking on my phone, but looking at my computer. Apologies for the microphone issues. I wholeheartedly agree. I mean, obviously I'm wearing a research hat, but a lot of these principles still are consistent across research. So we would always prioritize working with community groups, not conducting research on, but research with, so in partnership. So as a PI or as a leader on a research project, I would always view research as being another co-creative process, as you said, Eunice. It is about co-creating or co-identifying where the needs are. It's about co-creating solutions, and it's about co-testing those solutions for populations as well, to see, okay, well, do we need to kind of tweak things? Do we need to do it this way? Do we need to try this? And having it less be of a top-down approach. And I also just want to echo Eunice's comment there about the need to kind of surround yourself with equally strong and intelligent people that will also kind of you support each other. And there's a real kind of mentorship role that I really enjoy in the leadership position, as in a titled position, but it's really not about, I suppose, leading in terms of I'm going forward and you follow me, but let's look at this together and see how we can actually address this more collectively. So yes, I would absolutely agree with everything my co-panelists have said so far.
Thank you so much, Frederique. Back to you, Ailbhe. I'm wondering, can leadership be taught, or is it something innate? Because I wonder, is it something that comes with age and experience? But then I see people like Greta Thunberg and Malala Yousafzai, incredible young women that really do bring people with them and lead from the front, but not forgetting everyone who is around them. So I'm wondering what your view on that is.
Well, I think, first of all, I would say both in a way. I think it can be either or both, or one of the other. That is to say, is it innate? Can it be taught? Can it be learned, and so on and so forth? But just listening to the other great panelists, I was just thinking there is something when we're talking about leadership that we also need to think about, and we do, and talk about, which is power. Because a leader is expected to be powerful, is expected to have power. And I think really a key question for all those of us who are absolutely committed to human rights, to equality, to social justice, is to have that incredibly acute awareness of what we do, and how what we do with, and how we actually manage and think about and work with that power that we have for reasons that are not always absolutely just, if you see what I mean, that we can find ourselves in situations. And I always think that I think of it as having power with and alongside others. And also, I suppose there are elements of empowering others and not having power over. So I think the ways in which I would think of leadership are much more about, among equals, primus inter pares, that you are very much among equals. And I think that understanding came to me through the women's movement and feminism. So on that basis, I think that leadership can certainly be learned and taught. I mean, when I was a child and a very obstreperous teenager, stamping my foot right, left and centre, I wasn't really thinking very clearly about what I could do about things. And when I started to think about it, then I realized that you're you need others. I've always said that you need 2 is fine, but 3 is the basis of a social movement. And then you could really bring others, I think, along with you. My own experience, again, I have learned an enormous amount over the years. I don't know if I always put it into practice, but therefore I do believe that you can learn how to lead in a way that is cooperative, that is collective, that is focused on ensuring that everybody is moving along together. And I believe that we achieve so much more when we work in that way. And top-down leadership, I don't hold a candle for that, which means that institutionalized and organized politics have never really been my thing.
Thank you, Ailbhe. Mary, would you agree with much of that? And I'm wondering, from your point of view too, the issue of representation being critical for authentic leadership.
Yeah, you know, absolutely. I mean, Ailbhe, absolutely agree. And I think one of the points, just picking up there, Ailbhe, from your points were around how this authentic leadership, we cannot be extractive. When we're working with communities, what happens is a lot of the time, particularly in advocacy, you're looking for that story that will change the policy maker's mind, or you're looking for that piece of data that you think will change the policy maker's mind. But ultimately what you're doing in that is then disconnecting from the human being that you're working with. So this area, I think Eunice spoke about co-production. When you have that type of leadership, which is bringing a movement together and you're co-producing, you're really, you know, the power dynamics, it has to be shared. And authentic leadership, you know, I mean, I work for an INGO, and an INGO that is a development and humanitarian organization. And while INGOs do amazing, outstanding work, there's also a lot of challenges in terms of what's your role actually into a national country where you don't live, how are you connecting in with communities, and the whole localization piece. So to me, the authentic leadership, even from, I'm a disabled person who can speak about disability issues, but I cannot and will not speak on the perspective of somebody coming from living in a small community in Rwanda. It is absolutely not the same. So I think it's that reflection that we need to have as leaders, that sometimes we find ourselves in situations where we're able to have a word with a policymaker, but if it's not connected back, or if that person that we're thinking of isn't connected into that conversation, then I find it can be extractive, and I find myself really challenged in those situations, because representation, authentic representation, is making sure that that voice is heard, not my voice, and that's a big challenge we face at a global advocacy level, and also at a national level, advocacy level as well. Yeah,
absolutely. Eunice, what are your thoughts on that? How do you address that issue of authentic leadership, and how do you address resistance to it, address power inequality when it emerges?
That's quite interesting, because I think for me, the first thing is the reflective part of it. Like, what does power really mean to me and also to the people? And I think, like Mary said, you know, when we are representing people, we need to be aware of who those people are and what is their understanding of power. I always use this example, like in Africa, there is this huge campaign about education for girls, and you know, there is activists, there is advocacy, there is, you know, media coverage of it. But to the people, actually, the moment we started doing that, we have fathers now training their girls and keeping the boys at home, and then selling their girls now to the highest bidder for marriage because they've gone to school. So, you know, we've gone in there, we've done this powerful initiative, but what we've done is that we've now created another sense of imbalance. So we've overused our power in a completely wrong way, thinking we're doing good. So I love what Mary said, like, we need to be aware of that. And those resistance would always be there. I don't see resistance as anything bad. It's a force in itself. It's a pull, it's a push, it's what makes us grow. It's when we now use that resistance or the power that we have as leaders to actually undermine or repress other people then to me, that is the issue. And that is what we need to start looking at. How are we wielding the wealth that we have, or the wand, of our leadership? Are we actually giving the power to the voices of the people? If we have asked the questions, the right questions to the people, what is going on? How is this? How do you want this to be addressed? How do you want this to be done? Then I think that power inequality, I'm not saying it will go away forever, because we do need some form of inequality so that we can have something to fight about in global health issues. But I think the most important thing is that addressing or redressing those things within the context that we are talking about is very, very key. Yeah, thank you.
Lots of messages coming in, agreeing and very supportive of what you're saying, overusing power, thinking we are doing good. So thoughtful from Eunice. That's a message from Anita Friel from Goal. Thanks, Anita. And Breda from Concern. Nothing about me without me in all contexts and circumstances, I think, is the approach to go. Frederique, what are your thoughts on this issue?
Just want to build on a little bit on what Eunice has said, because it strikes me as well that I think authentic leadership is about having that humility to realize, okay, we're not doing this correctly. We need to change tack, and being able to say, we made a mistake and this isn't working. And how do we address that? Because I think, these very kind of top-down models discourage that. Going back to your point, Ailbhe, they very much discourage this idea that, okay, well, we've messed up here. We need to be humble about this. We need to go back to the drawing board, and we need to look at what worked, what didn't work, and try to do things differently. So for me, authentic leadership definitely has that kind of humility component to it, and that needs to be brought in and into our structures and allow for that to be able to be expressed and to be addressed.
Thanks, Frederique. Ailbhe, on that question then, and we have touched on it already, but perhaps you would elaborate on how then can we do leadership differently so that inequalities are not perpetuated?
Well, that's actually a very, very big question. I'm not sure that I have an answer to it, because I think that it depends on the context that you're working in. It depends on the issue. It depends on the situation. So I've never, ever been able to give sort of models or templates for that. I think that there is something very important when you are de facto a leader one way and another, or are seen as such by others, or have that sort of vested in you, that you have to be incredibly thoughtful and aware at all times, for all of the reasons that the panelists have explained. And the nothing about us without us that Breda raises in her point is very, very key. At the same time, there is an expectation that you will assume a kind of responsibility for what is happening, because groups of people, unless they have a direction to follow in, can wander all over the place, as we very well know. And I think that role of giving or developing along with others as a cooperative process, a sense of direction, the way to go, is one that people who find themselves in positions of leadership can and should absolutely recognize and embrace. Because I think that there can be, for women in particular, that nervousness around leadership, partly because you can also be very criticized as a woman who is a leader. You are very subjected, very open to criticism. So I think we can shy away from it. And I think one of the things that has struck me over the past couple of decades or so maybe, is that you have to be able to embrace it and not see it as being the be all and the end all of anything, but just that you are in a particular position at a particular moment in time. You need to equip yourself, you need to be thoughtful, you need to be careful, you need to be focused on your egalitarian principles, and then you need to get on with it, and you need to think about the directions and the strategies and the so on and the so forth. There's a lot of the pragmatist in me as well, I think.
Mary, do you agree with that? What's your own view on how leadership can be done and must be done differently to avoid maintaining inequalities in our system?
mean, I think it starts with ourselves. And I think, as Ailbhe said, in terms of, you know, we have a responsibility, and we also have an accountability piece as well, in terms of, you know, being accountable to what we do, whether it's speaking at a UN event, or whether it's you know, speaking into policymakers. I think in terms, from the leadership piece, in terms of the inequalities, it's really kind of also unpacking. I mean, the co-journey and the co-production is really, really critical, but sometimes we also find ourselves in spaces that we need to act quickly. So it's really that kind of reflection piece, which I think everybody else on the panel has spoken about, in terms of unpacking also what our assumptions are in any given moment, because we have them, and it's really, and also what our triggers and our biases are. I mean, I can clearly say I've been in situations where I've been triggered, and I've also come with a bias that has not been helpful. So, you know, it's that constant self-reflection piece, I think, which is really critical, particularly even if you're talking about bringing together a community of having a very diverse views, that you're constantly checking yourself around, you know, your perceptions of the capabilities of people in the room. And you're constantly checking yourself about who's not in the room. So if I've been in charge of inviting this meeting and convening this group of leaders together, who have I not included? So I think these are kind of just, I suppose, we don't always think of them. And I think we're also quite self-critical ourselves. I think Ailbhe spoke there about the women in leadership. We also probably criticize ourselves sometimes too much as well, in terms of not actually then being able to move forward, because we're thinking, well, I've really done a bad job at that. So, you know, I'm actually now less confident to do it. So I think the other piece is the confidence you need as a leader. So as Ailbhe said, yes, convening people together and moving people in a direction, but you also need a confidence to lead. But that doesn't mean arrogance. It means confidence, and it means inspiring confidence in others.
Eunice, you don't work in isolation, clearly, and you work in places, in countries, in communities with very powerful institutions, governments, sometimes corrupt governments. So how do you push for systemic change in the whole area of global health?
That is the question. That is like a $1 zillion question. I think my mantra for that is first, that no one, I read this book by Dr. Eger, it's called The Choice. And I think one thing that I took out of that book is that no one can take away from you what you have put in your mind. So when I go into those systems, that's like, it's like a pinpoint, like that's all I see. And what that does is that it allows me to take myself away from the corruption and stand on the outside of the voices that I'm trying to represent. I'm kind, but I am not nice, especially when it comes to the oppression of people's voice. And I'll clearly give you an example. So when I was working in the emergency department in one of the government hospitals in Nigeria, World Health Organization would give money so that there will be drugs in the pediatric hospitals. And the mothers will come with their children, and the nurses and the doctors will still be sending the mom away to go and buy drugs. I mean, this child is weeping, you know, probably could pass away, and then you're sending the one care person away. And it took me a long time to actually be able to say something about it or to do something about it. I trained in the States, so, you know, the thing to go in there was like, you need to go in and change it. But when I saw that, the first thing I needed to do was like, okay, what does the mother think? She said she doesn't care. She just wants her child to be better. But then our voice is not being heard. And then I stood up, because you have to say something in those kind of situations and call it out as it is. Like, you know what? There is a reason why we have, okay, give me the money, I'll go and buy it. Let that woman stay with her child. There will always be corruption, and there will always be those kind of systemic changes. And I think being a leader, or being in the position, or being in that opportunity to bring those voices forward is critical. But like we've always been saying, is the reflective part of it. Like, where do you fit in all of this? Can you keep quiet? Can you say something? If you say something, what are the repercussions? But you know what? It's the confidence, like Mary said. we just need to stand on that thing and say, this is wrong. This is wrong. And they will, eventually we all became friends, because then they know you because that's who you are. Like, this girl will say something, she doesn't mean it in a, bad way. She just means it in a kind way. And it's just passing those little messages across little by little, because one person's mind that you change today could become a ripple effect for other systemic changes that needs to happen. Yeah, thank you.
Absolutely brilliant, Eunice. Thank you so much. Frederique, what's your view on this? In your work, your research, what do you see as the systemic changes that are needed in your area of global health?
Well, I suppose academia is a very old institution, and it's incredibly hierarchical. And I suppose where I work, Trinity College Dublin, we've had our first female provost elected in nearly 500 years last year. So it was a big movement, or a big achievement for us as an academic community. But the structure that college and how colleges are structured is incredibly hierarchical. And there's a lot of things that need to change within that. People coming in very low level or kind of entry level positions or on very precarious contracts. I mean, we're talking about people with, who have done maybe 4, 5, 8, 9 years of education that are actually coming into a postdoctoral position where they have a 1 or 2 year contract. So there's a lot of precarious contracting that happens. It's very difficult to make tenure. The jobs are not very available. So there's a lot of things that need to, and I'm just talking about academia as kind of the world that I'm kind of operating in at the minute. But, there's a lot of things that need to change within this very antiquated structure, which is based on this very kind of hierarchical approach to management. And there's a lot of things that need to change there, for sure. I agree with Eunice, though, that it's sometimes, being kind is always very important, but being nice is sometimes not necessary. And sometimes I think being able to, being in a position of power and being able to amplify the voices that are not necessarily always being heard, that comes with that position, and you have a responsibility to kind of do that. I would be very difficult to, I suppose, get fired because I have the privilege of being in a tenured position, but some of my colleagues do not. And so it's much easier for me to be able to voice some of these concerns than someone who is not in that position. And you need to be aware of that.
Thank you, Frederique. Eunice, a message for you. Your empathy is so apparent and you need it for advocacy and activism. It is the enzyme for solidarity. I love it. Thank you so much. Thank you, Maka. Ailbhe, I want to come to you on this systemic change that is needed for global health issues, any type of issues really. And I'm thinking in particular of your involvement in the Repeal the Eighth campaign. That was an issue which dogged Ireland for decades and decades, and many people couldn't see how that would come to an end, how that would change, particularly at political level. So do you see what happened as a huge systemic change? It was also a cultural change, clearly, as well. How do you define that?
Oh, yes, I do, very much so. I think it is a systemic change, and it was a change which occurred for and happened over a long period of time, as you say, and for many complex reasons. I think when we're thinking about, global health and change and systems, it's also very important to see whether it's global health in general or whether it is a health issue within a particular environment, that this is part of an entire social system, and you can't actually take on the whole social system, but you have to be able to see the connections between things. And there is absolutely no doubt that in the case of reproductive rights in Ireland and in so many, really globally, we are up against very, very strong vested interests, which have to do with patriarchal power, which have to do also with organized religion in many cases, which have to do with capitalism, which have to do with all kinds of really big systems that you're actually taking on. And I would go back to Eunice's point that really the key thing that that individuals and groups of individuals who are contesting these systems and building themselves into a movement to do so, the first and the continuing thing that we need to do always is to call it out, is to name it, is to identify the problem, is to identify the structural reasons, which is where researchers like Frederique and also like Eunice are incredibly important, to be able to say, this is not accidental, this is not a coincidence, there is a pattern, there is a history, there is a reason, and it is not in the interests of those of us who suffer as a result of it for this to continue, and we are going to call it out. So just to go back for a moment to issues around and questions around leadership, I think that it's very important for us to empower others. I think it is very important for us to be able to inspire others to have the confidence to do that work of calling out, which you can't do if you feel vulnerable, if you are vulnerable, which you can't do. It's not just about confidence, it's also having that sense that you will have a kind of protection around you if you do speak out, because it requires you to be a bit braver than the next person. It requires you to be maybe to summon up a courage that you didn't know you had. And you do that best when you are surrounded by others that you are working with. But that is the only way. And I would come back and say that I think the big changes that we have had, certainly as women, and thinking of many other discriminated and marginalized groups, thinking of myself as lesbian, thinking of others who maybe those big changes haven't happened enough. I'm thinking of disabilities, for example, Mary, and thinking, well, you know, it needs that big push right now at the present time. But speaking out against racism, that has actually come from collective people power coming together and saying, enough is enough. We're not having it anymore. We're calling it out. We're naming it. And we're telling you in detail, researched, why it's wrong. And how it can be mended, how it can be fixed, how we can, you know, fundamentally, as a campaigner, as an advocate, you are about changing the world. And you have to accept that.
And Ailbhe, is there a personal cost? I mean, I
was going to say, Audrey.
Oh, yes.
Yes, you won't always be liked or loved for that. I mean, I'm very touched by Eunice saying, you know, we don't have to be nice. It has never occurred to me that I should be nice, to be frank. I think you have to be polite, or I think it's good if you can be polite. Not always absolutely possible. But yes, there is a personal cost. And I think very often that those of us who are maybe a bit older can actually be maybe helpful to those who are younger and who are setting out on that path, and can also offer some of the protections that you need. I remember, you know, and again, I'm quite touched by Frederique saying, you know, as an academic, you're kind of safe. That wasn't entirely my experience in UCD, I can tell you. And I remember when two of my wonderful mentors retired, Professor Helen Burke and Dr. Margaret McCurtain, that I suddenly realized, this being very personal, I realized that my back was exposed. There was nobody watching my back in that institution because I was the big girl, if you see what I mean, and my bigger girls had gone. And that's a very small, very practical example. And in fact, you can pay a heavy price, but I don't think we should have to do that. And I think we need to have better mentoring and better networking systems. We think of mentoring as being for those who have very little and you're trying to bring them along and raise confidence. I think actually that the people who are kind of already there also need mentoring. And I'd like to put my hand up to say I'm willing, I'm able, more or less, but there you go.
Thanks so much, Ailbhe. My goodness, anyone lucky enough to have you as a mentor would be very, very fortunate indeed. Mary, what is your view? I'll just go back to the original question, I suppose, because of your work with CBM Global Disability Inclusion, which works alongside some of the poorest and most marginalized in the world. How do you stand against or push for those systemic changes?
Well, I mean, it's quite challenging in some of the countries that we work in. And I mean, Ailbhe mentioned the protection piece, and it's something that we have to reflect on from an advocacy perspective. We've had an incident just quite recently where we had, in one of the countries we work in, there was a particular exposure to one of our country teams that was raising something that was possibly, not well received by the government. So I think we have to be very cautious in advocacy when we're working at this level and supporting into countries that don't have the openness that our country gives. And I honestly don't think we actually acknowledge that quite a lot. You know, I think there's always vested interest in how media and politicians will work, and we know that. But in countries where civil society space is being shut down, that systemic change is becoming even more problematic now. And, you know, the reality is our world is also changing in front of us. So we talk about how do we influence systemic change. It gets quite challenging when we're looking at, you know, rolling crises that have happened over the last 2 years, and we're in disaster economics, we're in planning for, you know, we have war, we have conflict. So the world we even though that's been prevalent in many of the countries we work in, it's becoming more and more prevalent to also ourselves. So I think there's a reflection that's probably needed at this point, because I find myself sometimes sitting in meetings going, oh my God, is anybody paying attention to the external environment which is happening? The world, like the geopolitical changes, the spaces that we're in are now changing, and we're still talking business as usual some of the times. And actually, that top-down piece is where that comes from, because we can talk about that from the privilege of sitting in Ireland and not having that threat against me. And I'm sure Eunice can speak to examples of that. So, you know, I think that's a really important point around the protection and making sure the advocacy we do doesn't put communities that we work with at risk. So the influencing systems change, I think, is really, it's harder to do. And you're also talking about lower resourced countries as well. So you have to be smart about how to actually make changes. And I don't think any of us have found the gold template on that yet. I will certainly put my hand up to say that, but yeah, it's a challenge. Yeah.
Thanks, Mary. Eunice, would you agree with much of what Mary has said there?
Definitely with all that she has said. Just to add to that is the fact that so I'm doing a project currently in Malawi. It's in the rural community, and the power imbalance is there just because I am Eunice coming from whatever it is, even though I am Black. So there's still that power struggle. But the people themselves, I realized that when you tell them the amounts of power that they can have, they actually started challenging us as the projects along the way. Because at the beginning, you know, that was made clear, like Eunice is not here. I do not have the golden bullets. I'm only here to do a PhD research, you know, reduce smoke in your community. You have the power. It took time for us to build that. So I think what I'm trying to say is that I think slowly we can change the system, and it can start by empowering or giving the power to the voices of the people so that they know what they can fight for. They know when to push, they know when to pull. Because like Mary is saying, in sub-Saharan African country, it's just so hard to fight a systemic change there, where the external forces from the global north are influencing whatever it is that you were trying to, you know, to correct. And that's another debate for another day. So it's very important that we start from the ground up, from the little children, letting them know, you know what, you have the rights to education, and you can actually ask your policymakers about it, you know, when to push, when to pull, and like Mary said, to be safe. So it is possible. It's going to take us a long time, but I think now we need to start and just start it. That's just it.
But how do you, Eunice, maintain your enthusiasm, maintain your drive when you hit those walls, when you hit those obstacles?
I back off. And that's the first thing I do. If I feel there is, you know, like this is getting really, so I will back off and go and reflect. But I will come back. That's the thing. I've always known that because Maya Angelou did say something that when you know better, you do better. So the fact that I've known better, I just cannot not, you know, go back. So the enthusiasm remains because I know it can happen. You know, it definitely can happen. It's going to take time. It's going to take effort. It's going to take cries. It's going to take laughter. And I laugh a lot. So by the time I start laughing, people just be like, is this girl hearing us? You know, and it kind of like diffuse the situation, and then we all can step back. So that's what I mentioned earlier, like kindness is very key. You know, and I think Nadine mentioned earlier on and said Father Michael told her that, you know, she has to love and she be the love. So like those are kind of, you know, what I do, because it's a blind mine in global health issues. You just don't know what you're gonna step on. So you have to protect yourself and put yourself in that bubble of love and happiness. And when it's too hard, step back. Just step back. That's it. Yeah.
Thank you so much, Eunice. Frederique, this session is Women in Leadership, and the four of you are leaders in your own fields. Is there a difference gender-wise between female leaders and male leaders? Is there an actual difference, do you think?
That's a very difficult question, I think, to answer. I think it's like there would be differences between people generally in terms of forms of leadership. In my experience, I do think I've had some great mentors, phenomenal mentors like yourself, Ailbhe. I've benefited tremendously from the mentorship of senior female academics who have been with me throughout the entire academic journey. I think if I was going to generalize, and this might be sexist, is I think women do tend to take on more of these kind of caring approaches to mentorship. We are attracted to these and whether this is biological or, you know, something that is culturally transferred is a whole other issue. But I do see women taking on more of these kind of caring styles of leadership. But then I've also seen some very, very horrendous bullying type of scenarios that are also propagated by women as well. So like I would actually really hate to generalize, because I've you know, a very small sample size, but I've experienced both. And it's not, I don't think it's determined by your sex. I do think that women tend to find themselves in leadership positions in different disciplines. And I think that comes maybe with the type of careers that maybe women choose or have to take because of other issues like childcare. So we do kind of factor these things into the careers that we take as well. But I would actually, I'd be reluctant to generalize, even though I did make that kind of observation, which is not founded on anything else but on my own observation at this stage. Difficult question to start off with.
It is a difficult question. I'm curious to Ailbhe what your thought is on that question.
Well, you know, the research is out on this one, really. Nobody can agree as to whether or not gender does make a difference to leadership. I mean, I think myself that because for very many women, that position of leadership has come with difficulty, has been achieved with difficulty, and may also have a cost. I think that there is a greater propensity to be thoughtful and to be self-aware and to be sensitive and empathetic. I don't think that these are essential differences between women and men. I don't believe in essentialism myself, but I also think, and just speaking for my own generation, that certainly through feminism and the women's movement, I mean, we did think very seriously, obviously, about power, and also how we could do things differently and how we could lead differently. So there have been very conscious efforts, thinking on the part of many women to be in a position of leadership in a different kind of way. However, I don't think that has to do with some kind of innate gender essential quality, because I do believe that it used to annoy me hugely, and it still does actually, when equality programs are focused, as they so often are, on women. And I was saying, but we're not the problem. It's the men who actually need the equality program. Somebody needs to get them and to say, this is what equality looks like. And that goes right across the board, but it certainly used to happen in my university. I think it may have changed now. I hope so. So because I do think that men are absolutely capable of being humane leaders who have a consciousness of the importance of the collective and cooperative approach. I think that's possible. I think that we need to foster and encourage and promote that among men and encourage them to lead in this way. When I look at world leadership, though, I sometimes despair. I absolutely despair. But when I look closer to home, I think, no, there are very good men in positions of leadership. They are perfectly capable of it when they turn their minds to it. And I think I'd like to say that it's our job to do that as women, but actually we're very busy, frankly, and there's so much that we have to do for women that they're going to have to do that for themselves. And it's about time. It is now, whatever it is, 2022, and the world is in a state of absolute chaos, as Mary was saying. And they need to get with the program very quickly, because frankly, there won't be a planet for us to be even concerned about by the end of this century, unless men start actually changing their tunes. So I'm much more concerned about men in leadership than I am about women in leadership, frankly.
Ailbhe, thank you so much indeed. Mary, maybe you would give us your view on this, because I'm wondering, are women leaders treated differently then? And Breda has put into the chat that women form 70% of workers in the health and social sector, but overall there's an average gender pay gap of around 28% in the health workforce.
Yeah, I mean, I won't go over what Frederique and Ailbhe and Eunice have said, but I think I think circumstances also make leadership. So like, create a leader. So what your circumstances, where you're coming from, and you can, whatever your gender is, so you can come from, a really living in quite an adversarial space where your leadership has to be very different, whether you're male or female. If it's more open, there's also, so your circumstances shape that. In saying the male-female divide piece, it's interesting, because as I reflect on the disability movement and just observing it's actually fairly male driven. So it's, we leaders in Ireland over the years would have been coming from, I'm thinking of people like the brilliant Martin Naughton and Donald Tolan. They were kind of the key leaders within the disability movement in Ireland. And even at international level, a lot of the international kind of organizations are led by men. And actually, Pamela Molina, who spoke yesterday, is the executive director and leader of the World Federation of the Deaf. And I think she's one of the few women leaders that are there within the movement. Now, I won't say that because I don't have the evidence on. I'm making quite a general piece. But I do think your circumstances shape how you are as a leader. And obviously your circumstances has that aspect if you're male and female, but there's other environmental pieces that also shape that. And just to come to Ailbhe's point around climate, I think, this is the issue that we're all facing now. And a lot of the work that we're doing is really trying to look at, working with and partnering with organizations of persons with disabilities to build leadership in climate. And the young people are really leading us in this. So, and actually, if we think it's probably quite a young female leaders that are leading around climate. So I don't think there's any definitive answer from my side on that, because I think I'm not a binary siloed person. I don't think that way. So I find it very hard to have an analysis around that. I think the movement building piece that we've been speaking about, it's really critical that we break these silos down, because ultimately what we need is for people to come together and to bring their skills, particularly in the fight against the climate crisis that we're facing. Finger pointing and blaming, is not going to move us forward. And I think we're in a space at the moment where, there's quite a lot of challenges in terms of, young, very empowered people who are holding older generation of us to account, which I think is really critical, but also we need to try and find a way to work together, because, we shouldn't be battling our own communities around what change we need for the future, particularly when it comes to climate.
Mary, thank you so much. We have 5 minutes left. The conversation has just flown by and it's been brilliant. And Eunice, I'll come to you with this one because you've experience of being a young early leader in your field, I suppose we'll put it like that. And I'm wondering, do you have any suggestions as to how people can encourage more younger people to become involved in inclusive, representative, equal leadership?
I think let's just talk about it. I think that's what it is. Let's put it on the table. You know, as a young researcher, or however it is, I think I don't see, like Mary was saying, I don't see binary. I don't see. All I see is global health issues and what the solutions are, and let's talk about it. And I think that's what people want to hear. They don't want to hear, oh, it's the male versus the female, it's the past colonization and the current colonization. People want to know, what can I do as a youth around that? And youth will often step back until they know they have the platform that is ready for them. And like I said at the very beginning, we really need to be careful, or I know I need to be very careful when it comes to inclusion. Inclusion means there is no gender, there is no race, there is no color, there is no degree, everybody gets into that pool. Dr. Ryan said it this morning, and Robbie echoed it, Mary, everybody's echoing it, until we stop putting ourselves into these different boxes. A boy child will feel left out now. In the next 50 years, we'll be saying education for boys, and then we'll be saying, so we just need to, we've made the mistake, let the kids know, yeah, we as adults or whatever it is, we've made the mistake. Now we are trying to correct it. And this is what we want to do. We want your voice. We want your opinions. We want your views. Fight with us, argue with us, sit with us. Let's create this solution together. So that would be my advice in how for us to bring the young ones together. Let's be honest. That's just it. Yeah. Thank you.
And Ailbhe, I know you've spoken about mentorship and how important that is. I'm wondering, I look at the younger generations, the 18, 19, 20-year-olds, and I think they're wonderful. And I have great hope for the future generations. Do you?
Oh, absolutely. I mean, I've been very fortunate over the past decade to work a lot with younger people on campaigning, on big referendum campaigns, and they're absolutely extraordinary. The young women and the young men, they really, really, really are. But they do need to be encouraged and supported in all of that. And I do absolutely take Eunice's point. I would love to think that we were in a world where we could say gender is no longer it's no longer a signifier for inequality, for discrimination, for marginalization, but it is, along with certain ethnicities, along with certain race, along with we're not in that situation yet. And until we are, I think we do need to ensure that young girls in school in particular, that they really get an education which really strongly encourages them to see themselves as agents of their own lives and in their own lives, and that they are capable of taking on the world. They're going to need to have that capacity, and for boys to understand that they are not lords of everything, and they still are in many playgrounds, as we know. So I think that there is still that work of evening out to be done. But I do dream of a world beyond gender where we won't have to fight all the time on that, and where we can tackle inequalities kind of head on in a way. I'd love that. But Eunice, we're not there yet. We're not there yet.
It's been absolutely brilliant. I will sum it up through Rachel on our chat: for inspiring, intelligent and truly compassionate human beings. Thank you all so much. Mary, Eunice, Ailbhe and Frederique, thank you for joining us and for being such brilliant panelists this afternoon. Stay tuned for the next panel discussions coming up in just a moment.